Haley, do you want to take it away?
Sure. If we can go to the next slide, please.
Oh, there we
Thank you. So as Carlene said, welcome everyone to the Health Equity and Social Determinants of Health Work Group session. Our agenda for today, we'll be doing a brief introduction of the group leaders, an icebreaker. We will review the group mission and goals. We will talk with all of you about challenges and barriers to reaching our goals for 2025 and beyond. We'll talk about what health equity and social determinants of health look like in your respective regions and successful pivots. We have a solidarity statement from the group. And then at the end, we will have some time for questions, hopefully, and then any tips and takeaways.
So our icebreaker today is pretty simple. And I wanted to try this strategy called Chatterfall, which is where everyone will enter their responses in the chat, but we'll have a countdown and we'll send them all at the same time. So it'll appear like a waterfall of chat responses. So we'll try it and see how it works. So if you can just share with us in the chat one or all of these, an emoji that you would use to describe yourself, one awesome thing that you want to share from this year, one thing that you're looking forward to, and one thing that you're grateful for. So if you can go ahead and type those in the chat, and we'll do like a 3, 2, 1 countdown. I'll let you know when to click it. I'll give everyone a few moments to just get your responses in. And if you sent it already, that's okay. And then we'll just read off a couple of things that folks shared. Okay. So hopefully we got some responses going, and then we can all hit enter 3, 2, 1. Click and send your responses in. And we are getting a few. Fantastic. So we have on sabbatical leave, grateful and enjoying. That's wonderful. Teresa sends a celebratory emoji. Tiffany has an upside down smile. Summer break, the holiday support of friends. Fantastic. Completing PhD on Friday. That's amazing. Good luck with the final edits. 11 years, that's okay. You got there. Um, got to spend a lot of time with friends this year. Looking forward to going home for the holidays. Grateful for community. That's amazing. Furthering career, concert in Chicago. Grateful for like-minded individuals. Wonderful. Loving all the people, less stress. I love it. Grateful for the gift of life, traveling, returning to the master's program. Lots of wonderful, positive things. Thank you all for sharing. I appreciate that. We have a lot of commonalities, lots of gratitude, lots of celebrating, and plenty of support, which is really nice to hear. Okay. Mike, this is yours. You're on mute in case you're talking. We can't hear you.
Sorry about that. And we thought it'd be important for us to share with you all our mission statement that we welcome a better understanding of our group and possibly join it if you're interested. So we've got 4 main points. Our first one, of course, is going to be to foster collective knowledge in the plan for strategies for applying a social and structural determinants of health approach, ensuring health equity for all. We definitely want to go off of a strength-based model where we're looking at perspectives and learning from community of this issue. It is also to help monitor the ever-evolving changes in social determinants of health landscape, as well as the impact of health equity for all. and especially to look at our underserved and marginalized populations to focus on evidence-based community, as well as the participants through search for technologies for engagement, data collection, measurement, and outcome evaluation.
Thank you, Mike. And now we have our goals.
Thank you. So these are some of our existing work group goals. We do plan to, with the group, in coordination, develop a social determinants of health resource compendium. So that could be anything that you have found useful in your work or in your life or both. We will try to develop health equity guidelines for use by other organizations and businesses. We use the group for networking and reporting out about current events, what's happening in our regions. And then tied with that, reporting back to our local organizations and advocacy. So with this group, we aim to empower community voices and individuals with lived experiences. And finally, we hope to use the group to encourage local organizations to be equitable and engage communities in their decision making.
Okay, and we'll just take a moment to introduce ourselves as the work group leaders. So I'll jump in first. My name is Carlene Valentine. I work for Montefiore in New York. And I've been working in the field of HIV for about 20 years. I'm going to say over 20 years. Yeah. I just made 18 years at my org, I did about 7 years prior to that. So I think you lose count after 20 years. But yeah, definitely have been in this field for quite some time. And I've had the privilege and the honor of working on both ends of the spectrum, as far as having worked what we used to call Cobra case management for 7 years, the first part of my career, helping individuals and families living with and impacted by HIV. And then coming over to the prevention side, I've been working with, I worked with two evidence-based projects for about 7 years. So that was nice to be on the prevention side and the community education side for a bit. And then now I'm more focused on the Ryan White side of things. Still with an arm in the prevention programs, but that's a little bit about what I did. Also finishing my PhD, hopefully.
Thanks, Carlene. I can go ahead.
Sure.
So hello again to everybody. I'm Haley Deutsch. I'm currently the Director of Grants Administration for LifeBridge Health, which is a hospital system in the Baltimore, Maryland area on the East Coast of the United States, if we have any international visitors with us today. And I oversee all of our externally funded programs, so government funded or foundation funded programs for the hospital system. My academic background is in adolescent health, specifically adolescent mental health and violence intervention and teen pregnancy prevention. But now I do a little bit of everything. Yeah, I've been with the group for, I think, Carly, maybe almost 5 years at this point. It's been a while. And I've been in
Yes.
Baltimore for about
Mhm.
17 years at this point. And with my current organization, actually 2026 will be a decade. So yeah, lots going on.
For
Hello,
sure.
everyone. My name is Michael Gutierrez. My pronunciation is El en Español, and I consider myself to be a Mexican agent of change. I've been working in social services and public health for about 20 years, and I've done quite a bit in different sectors. So I've worked with individuals impacted by sexual harm, interpersonal violence, human trafficking. I've done a lot of work with advocacy around people who are undocumented, I was the program manager with a case management team in Chicago with a small agency called Howard Brown Health. And I'm currently with AHF in Chicago, which is the Age Foundation of Chicago. I'm sorry, the Age Foundation. And so they actually have clinics in 46 countries and in 18 states. So I'm here in Chicago to help build up their case management program for individuals living with HIV. I've also been very, very fortunate and lucky enough to be a part of a couple of different studies. I was also a research lead on a bicultural bilingual care team program with NASA, and I am currently extremely blessed to be a part of this group and working with these two individuals. I've definitely learned a lot from both of them. They're very amazing people, definitely a great wealth of knowledge. And I believe I've been with the work group for about 3 years. It's been
Mhm.
very exciting to work with these individuals as well as the group members, just to see like what is going on in the other parts of not only the nation, but different countries. So yeah, that's who I am. And that's who we all are.
Thanks, Mike. Okay. On our next slide is health equity, and that's also you, Mike.
Sorry, my computer was lagging a bit. So just to name something in order to help individuals just know where we're coming from and what our mission is. It's so important that we continue to find things as they may continue to change. But the way we're looking at health equity is that there is a concept of what I'm sorry. It originated from the many different disciplines of public health, sociology, as well as political economics, and it's been a major area of research for the technology since the early 19th century. It also emphasizes all the individuals that we should all have the same chance to reach our highest potential in terms of health, along with the important thing that no person should be left behind, and that we're all reaching basically the last.
Thank you, Mike. Okay, and this is our brief definition of social determinants of health, which, as most of us know, covers a pretty broad spectrum. Social determinants of health are the non-medical, social, economic, and physical conditions in which people are born, grow, work, live, and age, which can affect our health outcomes and ultimately the quality of our life. These factors include elements like income, housing, education, access to nutritious food, and healthcare, as well as broader systems like policies, economic policies, social norms, and political circumstances. And so these are the two main focuses of our work group. And sometimes I think in one year we leaned a little more on health equity, and then maybe the second year we leaned a little more on social determinants of health. So we kind of take the pulse of what is happening socially and politically, and kind of let the group guide which direction we kind of lean more focus on. But ultimately, we can't deal with one without dealing with the other. Okay.
Thanks, Carlene. So here is where we'd love some feedback from the attendees of this session. You can either type your response in the chat, or I think you can raise your hand and then the moderator can unmute you. So we would like to hear from everybody here. What do health equity and social determinants of health look like in your respective regions? And then we would also like to talk about successful pivots. So when you have reached challenges or roadblocks in your journey towards health equity, what have been some strategies that you have engaged to move past those or to redefine your strategy?
So I had added childcare stipends, for example. I hear is a thing in other countries, but not too much here. I know for New York, if you're income eligible, you probably can receive some assistance with childcare. Um, but I think the majority of working parents have to contribute some portion. So childcare is often a challenge on this part of the northeastern part of the United States, at least. But I'm sure there's other SDH challenges in other places that might be really different and specific to your region. So we would love to hear about that, and especially if they have found some kind of workaround to help folks out to get through those challenges. Or maybe we can do the word box. Is that the next slide, perhaps? Let me see. Let me check the chat before we go past the slide. Okay, I don't see anything in the chat. We don't have any hands up, right? I can't tell. I don't think so. Okay. No hands up and no chat responses. So, Mike, do you want to explain the? Well, we could discuss some of our challenges and barriers first, and then you can explain the box, the QR code.
Um, yeah, so we're just looking just to see what some barriers have been going on for you guys as a community. We do know that things will change, and because it takes a community to help the community, we felt it very important just to get a lot of feedback from everybody, that it's not just us saying what's going on or what's working, what hasn't. Um, and so we have a QR code here. If y'all scan the QR code, it will take you to a word cloud. And then in the word cloud, what we'll have is just people anonymously entering in that what they believe or what are their barriers that they're currently witnessing in their areas. And so we will share this word cloud just to see what are some common things. You will see some words bigger than others, and what that just means is we've had multiple people using that same term. So I can just say, I say, with everything that's going on with current culture, we've noticed that one legal barrier we've noticed was food, because SNAP was gone for a bit, but we've been able to come back. So if you all are able to do so, may you all please scan the QR code and enter a word or a couple words just to talk about the barriers you all are experiencing in that area. So then just scan the QR code, enter the barriers, and what we're gonna do is we're gonna screen share what this word cloud looks like.
Okay, I entered mine. And in the meantime, we can just touch base while folks are doing entering their words. Some challenges we faced as a work group in 2025 included, managing priorities. Of course, we like to participate in extracurricular things, and we still have our jobs and school and things. So managing priorities can be tricky. We've tried different meeting schedules, like quarterly and then monthly, bi-monthly. And so, we're always recruiting members. So hopefully some of you all will be interested in this topic and would like to join us and can help us to kind of revisit the scheduling. Um, Navigating several time zones is a challenge. We had someone in our work group from London at one time, and we have another member from Africa. So sometimes managing the time zone differences can be a challenge, but we do the best we can with that. So far, we've managed it. And of course, we have an evolving administrative landscape here in the United States that is keeping us on our toes. And so the work does not get easier, but we continue to push forward. And so we are looking forward to continuing the work group into 2026 and hopefully picking up where we left off with our compendium of resources, which really is a collective effort. We can't do that without a work group and without work group member feedback. So we're definitely counting on folks to let us know what are like solid resources that they have been able to utilize and that they want to share so that we can put it all together and share it. We're planning to put it on the website for the conference and encourage everyone to just share the resources because they really are helping a lot of folks out, possibly more now than previously. So we definitely want to continue to share that information. Mike, how's the word cloud, sorry, coming along? Should I stop sharing? Do you want to share or do we need to give a little more time?
I think we can share. And then for anyone who does not have a smart device where they can scan the QR code, I did put the website in. So if you want to go to menti.com, so that's menti.com, and then you can just enter the code that's 7435-2200, and then we can go ahead and share the screen.
Someone put in something in the chat and I'll just add it to the.
Oh, sorry. It looks like some people are having some difficulty hearing you. I do apologize for that. My laptop decided to go skydiving this morning,
No,
which is part of the reason why y'all don't see much on um, are
gotcha.
you all able to see the work cloud?
No, let me stop sharing and then, oh, there it goes.
I can see it, yeah.
Oh, nice.
All right. So it looks like what we currently have, for those who are on a smaller device, Sigma is a very, very big barrier. And that is something
Mhm.
that will continue to be a barrier, which is why it's so important that we come together and talk about what's working, what's not. So after that, it's like transportation, race, food insecurity, lack of resources. We got food again. Loss of staff, peer advocates, affordable housing, lack of internet access, and I would also take a step further and also say lack of technology. Climate change, definitely preconceived ideas, so definitely like a lot of biases. Support, what that looks like. And here we have language, which I think is so important because it's not just the languages that are spoken other than English, but it's also the language that people use when addressing concerns, when addressing patients, but then also what language are we using within our funding. Because as you all see, we had to do a major pivot for anything that was quote unquote um, and I say quote unquote because they added a lot of extra things in. We got funds, commute, lack of resources, the ever-changing resources, behavioral health resources, negative judgment, office hours, that is so important, especially since a
Mhm.
lot of the patients or a lot of the community members that really need these resources work through collar jobs, and oftentimes the agencies are only open during blue collar hours. So definitely is something that not only we need to speak about, but then also think about how do we pivot? How do we make our not only the location of our agencies, but the new hours of our agencies more accessible to the people who truly. So thank you for everyone who's participated. This is very lovely. Thank you.
So amazing. Let me put the slides back up. That came out really nice, Mike.
And there's
That
still a
was.
couple things added. What we could do as well is as people continue to add things, we could have this word cloud added to the PowerPoint.
Oh yeah, we can do that and send like a final slides for the posting.
Mm.
We sure
Oh,
could. We could take a
someone
look too
also
before the
wrote,
next one. Go
yeah,
ahead.
sorry. Someone wrote lack of office space.
Mm-hmm. I can put that in the I can put it in. Let me see if I still have it open. Yep, I can add it. Black. Because that is a real thing. Of office space. Okay, I added it to the cloud. Okay. Oh, word box, we did that. So this one is same concept, but this is maybe so that we can share some of the potential solutions. How have we kind of mitigated some of those challenges and barriers? So for us, so same thing, if you can scan this QR code and add your potential solutions or workarounds. Sometimes we can't completely fix the problem, but we can kind of soften soften the corners and make the edges a little less rough and find some workarounds the best we can. So please let us know what is working where you are and how you've managed to kind of keep pushing through. And for our end, we can share some of the ways in which we try to overcome our work group challenges and barriers were by recruiting new leaders. We definitely recruited Mike from a work group member to a leader. He's been doing an excellent job. Rotation of work group facilitation. So, we're thinking for 2026, if we can recruit a few new members, then maybe we can also take turns kind of facilitating the work group meetings, and then increasing interorganizational collaboration. So perhaps as members and leaders, we can recruit from within our own organization because we probably have other like-minded individuals that we work with locally. So if we can recruit 2 or 3 individuals from within our own organizations, that's another way we can kind of expand our work group to include more people and more ideas, more resources, and more exchanges. So let me check the chat. Mike, how is the word cloud coming for for solutions? Lizzie added mentor in the chat. I can go ahead and put that in the box. Let me scan the new code.
Yeah, it's looking pretty good. I also put in the website as well with the new
Okay.
code. For those who do not have a smart device nearby. And I will add just to the point that you were making is lived experience is so undervalued. Lived experience is great because it allows other people to think of different things that maybe they're not either aware of or used to, or if they don't live in that realm, they would not know to think of it. And so here, what I would love to add is not only employee resource groups, but also community advisory boards. And that is another great way to allow people from community to actually let other people know what is going on in the world, what's working, what's not. And it allows for everyone to make sure that they are not only at the dinner table, but also that they are eating the same dinner as everyone else.
I like that. I like that phrase a lot. I was just listening to the previous work group and they were stressing, not stressing, but they were strongly reiterating the importance of being spoken with and not spoken to, as consumers. And I thought that really is the smartest thing to continue to share because I think that it's not practiced enough. And we have to always play our part as far as if we're not coming to the table from lived experience and maybe advocating for those who are and making sure that their voices are heard and that they are being spoken with and not spoken to. um so I agree for that with the consumer perspective. We have body language or spoken at exactly. Should I stop sharing, Mike, so you can share the word cloud?
Yeah, I think we
Okay.
have submitted the responses.
Okay.
And for those who are working off of a smaller screen, we've got sharing best practices, responsibility sharing, reducing stigma, lived experience, compassion, empathy, trainings, building trust, refresher trainings. That is amazing because
Mm-hmm.
we want to make sure that we're not just checking a box, but that the trainings keep happening and they're going to different levels. It's good to have reminders and also allow the training to evolve. Partnerships, extremely important, especially intentional partnerships, adjusting language, utilizing staff, awareness campaigns, love that. That's so important and very much underutilized. Mentorship programs is amazing as well because it allows people to plant seeds and allow the fruit of whatever plant they have go to all community members and they can keep sharing. So it is a great way to help uplift everyone around you. Systematic approaches, support groups, 100%. Education, best practices, building trust is extremely important, especially as you know, healthcare in the states, they have caused a lot of harm to us. Um, I love seeking a subject matter expert. That is so important. Make sure I didn't skip anything. Oh, this is cool. Um, hearing simulation apps. That's really cool. Oh, similar. Yep. We've spoken at or with. I believe that is everything that we've so far. If people would like to continue to add things, please feel free to do so. And then at the end of this presentation, we'll make sure that the final word cloud for each thing is added to the PowerPoint.
Thank you, Mike.
I'm gonna stop sharing.
Okay, I'm gonna go back to the slide. Okay. Thank you so much to everyone for participating. That was fantastic. Because your feedback is everything for sure. Okay, word box. And our solidarity statement.
Thanks, Carlene. Yes, so we thought it was important for us to have a solidarity statement at this time. And what we are going with right now is that our work group stands with all of those defending immigrant and human rights, supporting families, and making efforts to advance peace and unity for all.
Sorry about that. Okay. And one of the things we always practice at the end of our regularly scheduled work groups is reminders, tips and takeaways, just things for us to kind of wrap up and remember to keep in mind. Particularly this year has been a little challenging, and so we wanted to make sure to remind everyone that sometimes the most we can do is the best we can with what we have. And we really cannot push ourselves beyond that sometimes. Also, the reminder to tune out and take off when you need to. It's really important. Lots of work to be done, and we cannot do that if we are burning ourselves out for sure. That it is okay not to be okay, and to recognize that within ourselves and give ourselves the grace and the space to just be present in whatever feelings we are in. Um, it is an excellent time to be leaning on each other, particularly those of us that do this kind of work, you know, the work of people and all things related to people and taking care of people requires that we take care of ourselves, but sometimes we also just need to lean on each other and be a support for one another. And that it's okay to seek support also. We are often providing the support, but sometimes we also need the support. Um, it's an excellent time to be kind. It's always a good time to be kind. And to remember that we're still here. Our work is possibly more important than it has been. Um, and as long as we continue to be in this space and doing this kind of work, we really have to also take care of ourselves in that process. So, whatever taking care of yourself might mean, a warm bath, some bubbles, candlelight, vitamins, exercise, being in nature, spending time with family and friends, laughing, whatever that means for you, make sure that you do that. I'm gonna just check
And
the chat.
oh, sorry, go ahead.
No, go ahead. I was just saying I'm gonna check the chat.
Um, and we would love to invite you all to our work group. So if anyone is interested in helping us with a toolkit or creating our network of resources, we would love to see you all. We will be reconvening our meetings in January. If not February, definitely in 2026. So please stay tuned. If you're interested in joining the website, please go to, I'm sorry, if you're interested in joining the work group, please go to the website. And here, just to make things easier for everyone, I have also added it in chat itself where you could sign up to be part of the group or just to get some updates of the day.
Okay, and any questions? I see some lovely comments in the chat, by the way.
Yeah, I just wanted to call attention to Francesca's comment in the chat. They said, I think it's important to acknowledge the invitation to the table has always been exclusionary. So many of us have been at the table, then told to leave the table only to be invited back to the table. We have to ensure that those doing the work are not words only in the invitation. They have to have works that prove the invitation is valid and welcoming. The people with lived experience without formal degrees are continuing to be excluded from opportunities for employment within organizations. So I think that that's a very good point for all of us here. Thank you.
Absolutely.
Any other questions or comments you can put in the chat or you can raise your hand. If you don't know how to do that, there's a little heart on the Zoom that says react. If you click on that, there is an option to raise your hand. And it looks like Joy has raised her hand.
I just piggyback off of what you just said about those with lived experience, but don't have a degree, not including in the conversation. Did you just say that?
That was a comment in the chat, yes.
Okay. Oh, okay. Yes, I agree with that. I just do want to say that national representing, which is our environment, we really are pushing for peer recovery specialists, which are those with lived experience. And I'm sorry if it was mentioned earlier, but I was late. But anyway, those peer recovery specialists do not have degrees. They just have to go through a certification process. But the state of Maryland and many other states are trying to really, really hone in on those with lived experience. So I just wanted to say that.
Thank you.
Thank you, Joy. In New York State, I know they're doing the same thing. They have like a peer specialist certification from the State Department of Health also to encourage organizations to recruit peers, as staff members and hire them, not just stipend, but like a paycheck, and as they should, because those voices are needed and they are the experts in the field for sure. So thank you for that, Joey. And here's our contact information. Feel free to email us if you have a hard time joining the work group or signing up by any of the links provided. You can feel free to reach out to us directly and we can help facilitate that process. But we would definitely love to see some of you in our first quarter meeting for 2026. And it's important work and everyone's doing lots of different things. So one of the joys of being part of this work group is that we get to collaborate with folks from not only other states around the United States but even other countries. So that's a rare opportunity, and we've learned a lot from our colleagues in different places, and we'd love to be able to share that experience with you all and to continue that going forward.
Thanks. And we would love for group members also to suggest topics for meetings or for discussion. I think there is a discussion function on the online group meeting place. And then also we will have opportunities for group members to lead group meetings as well. And it looks like Lizzie, did you raise your hand?
I did. I was looking for, I think I found it though, to link to welcome others to the group,
Yeah,
to
Carlene, if
the
we can
work
come
group.
back to that maybe.
Let me see. I think Mike put it in the chat. There's
Yeah.
a group's IO email list, so I'll copy and put it, re-put it in the chat. That's definitely one way to sign on. And then I think on also the Who Can You Tell website, whocanyoutell.org, the main website for this conference, there's also a work groups section on the lower left that you can click, and then you can look at all the different work groups, and then there's a link there to also join us. But yeah, if you have a hard time with any of those, feel free to reach out to us. Another thing we also are open to doing is if you want to just present on something related to health equity and social determinants of health, like whether it's like a regional project in your area, something you've done locally, if you did a presentation for your organization and you want to come and share that with us, like we're happy to just host those presentations. It's really just an exchange of information. What can we learn from each other, and how can we continue to support each other in the work that we do? That's the other goal of our work group. We want to compile the resources that we can share, but we also just want to continue to support each other in this space. I know we've finished a little bit early. We have time if there's any other questions or comments, things anyone wants to share, feel free. You're welcome, Charles. Mike, do you want to show the word clouds one more time before we jump off? I don't know if they changed at all since. And thank you everyone for joining us today. So we'll definitely have the word clouds added to our slides. And I think those slides are made available to you as well as the recording.
Okay, I got it. Sorry about that.
Oh, that's okay. I think I have to stop sharing, right? Sorry. Okay. All yours.
I share the various stuff. Looks like we've had 26 people answer that, so thank you. Here is our final word cloud for barriers.
Oh, I'm not seeing your screen. Are you sharing? Oh, there it goes. It's coming.
All right, this is the delay.
Okay. So definitely stigma, race, transportation, and food security are the heaviest hitters, it looks like.
So one thing that I know that has been added since is going to be isolation, religion, which is extremely important. As well as rural communities, well funding, of course, agency adherence, very much so.
Mm, I would like to learn more about that.
So, I will-
We got lots of thank yous in the chat. Lots of appreciation for the session and the information. Thank you all again. Thank you for sharing your time with us today. We appreciate it and we hope to hear from you in our session next year. This is the solutions. Okay.
We have to call for applying for grants.
Say it again, Mike.
Applying for grants. I'm not
Mm,
sure if that was added as we
maybe.
shared, but definitely very important.
Hmm.
We see not only grants are dwindling, but we've also seen, I speak for Chicago, a lot of agencies have willingly given up the grants just because of the changes that are happening and how they have recognized that with the resources they have, it would be a injustice into the work that they have. We cannot provide our own services or help patients the way they deserve or need the help.
I know for New York, we've seen it's almost like a rush of state grants rolling out. I guess in anticipation of potential loss of other grants, the state is trying to push out a bunch of RFAs. I've seen at least 10 in the past month um, get pushed out almost back to back, which is usually unheard of. So um, I think that more funding opportunities are coming to try to make up for potential losses that may also be coming. But it's nice to see. I know we've also seen a few announcements for foundation grants too. So I think the grant funding is just as always the challenge to find something that fits what your programs are looking to do.
I would also say, definitely for people as things are evolving, a lot of people have been utilizing AI, and I will say, although it is a solution, it is also a barrier. So please be careful when using AI, especially
Mm,
in meetings, because AI is not with compliance. So please be careful with that.
good advice to be careful when you're using AI for grant writing. Very good advice. Any final thoughts before we wrap up? I'll just go back to the thank you slide. Well, if not, thank you all again. It's a pleasure meeting everyone and sharing this time, and hope to see you in 2026. And I hope you enjoy the rest of your conference. It's always a good one.